There is nearly no chronic disease that I couldn't reconnect back to the mouth. A process has gone wrong in the mouth first. And even if you go back to breathing, but if your jaws don't develop properly, you are putting yourself at risk of long-term disease across the entire spectrum.
Right.
We've known, for instance, gum disease. People that have heart attacks, 85% of them have gum disease. Who would have thunk it?
No traditional cardiologists really talk about that.
No.
That I know, it's not in their radar.
So that was one of the moments as well that really kind of woke me up, because I had a patient come in and he was this old guy. He had a couple of standing teeth, really funny guy, but he was going in for a bypass surgery. And so he had severe periodontal disease all his life. And this was all tied into his heart disease and his type 2 diabetes. But so what the cardiologists do is they get a dental clearance, because they don't want a dental infection while he's going through surgery, because he's obviously going to have a long recovery time if he gets a dental infection. And so what they do is they send the patient to a dentist to get a clearance. And so when I looked at that, I said, right, we have to take these teeth out because they're a risk of infection. And so we took his last teeth out. We planned to make his denture because he was going into surgery. His situation was quite urgent, but he never made it through. He passed away.
Welcome back. It's episode number 215. Thanks so much for showing up and tuning back in. Today we're going to catch up with my friend Dr. Stephen Lin, the author of this amazing book. And I say that very sincerely. This is a fantastic book. And Dr. Lin is introducing a game-changing idea. The idea, well, many game-changing ideas, but I think the most, in my eyes, game-changing, is that this idea that health and disease begins really in the gut, like you've heard about, but the gut begins in the mouth. And so therefore, the mouth is really, I think, the gateway. And we're going to learn all about it in the episode coming up in just like 30 more seconds about how the oral systemic connection is the new frontier of health and disease for a myriad of different reasons. Number one, our oral microbiome, every bite and swallow and chew that we take, we're swallowing bacteria and the milieu from our mouth, and it's going into our GI tract and therefore affecting our immune system. So it's so key to have a healthy, balanced oral microbiome. You're going to learn about the nutritional and lifestyle strategies that can affect that. And most importantly, how we breathe, whether we breathe through our nose or whether we breathe through our mouth, and the structure-function relationship between our mouth, teeth, and tongue position, and how that affects our breathing and even our stress response. So that's what's coming up. It's an awesome discussion. Last but not least, we do talk about micronutrients, particularly the fat-soluble micronutrients A, D, E, and K, how that affects not only bone, and by the way, bone is active, it's remodeling, it's cross-talking with the rest of the body, it's malleable. So even as adults, if you're a mouth breather, if you have poor dentition, that's changeable, that's malleable through epigenetics, which we're going to talk about. So it's super fascinating stuff. Quite honestly, I wish I would have known about this, and my parents would have known about this over 30 years ago when I was a young child, and maybe would have prevented some orthodontic work and things along those lines and changed nutrition. But of course, we can't change the past. So that's why I'm sharing these videos with you so that you can make better lifestyle choices for the people that you care about. One of those lifestyle choices you've heard me talk a lot about before, we've talked about it on the podcast, is the practice of mouth taping. So I'm super excited to share a new mouth tape with you. It's called Somnifix, SOMNIFIX.com is their website. It makes the practice of mouth taping so easy, so compliant. Anyone that's tried mouth taping with a 3M micropore tape and got a little spooked because it seemed a little bit too barbaric, Somnifix is clinically studied. They did some research at Harvard, and it's made with hypoallergenic adhesives. You're not going to get allergies or expose yourself unnecessarily to toxins. It's very easy to put on and take off. Definitely check it out. I put it in the show notes as well. And last but not least, before we dive into it, this episode is proudly sponsored by Health IQ, a progressive and forward-thinking life insurance company. Without their support, this podcast would not be available. Let me tell you just in 10 seconds why you should consider life insurance. If you have dependents, children, a spouse that depends on you for an income, and something were to happen to you, heaven forbid, a car wreck, unforeseen health condition, and you didn't have life insurance, your family, your spouse, your dependents would be in a lot of trouble. They would probably rack up credit card debt, have to borrow money from friends and family, take a loan against your home, none of which would be good. So for under a few $100s per month, you can have comfort knowing that if the unexpected were to happen to you, your family would be taken care of. Now, the downside to most life insurance companies is they do not reward healthy behavior. They don't care if you exercise or eat fast food. As long as you have the absence of disease, they're going to give you life insurance in most cases. Well, Health IQ understands the message that we convey here at High Intensity Health, that prevention is a key element to vitality, to overall health. And they'll reward people like you and I, for participating in health endeavors, exercising, not smoking, eating a low-carb, microbiome-friendly, ketogenic style diet. How do they reward you? By helping you save on your life insurance premium. So I would highly encourage you to at least get a free quote and see if you qualify. It's very easy to do. You can go to healthiq.com/HIH. Again, that's healthiq.com/HIH, or you can click the link below this video in the description. So that's all I have for you. Hope you enjoy this discussion. As always, if you do, please give it a thumbs up, and we'll catch you in the actual episode. Let's dive into it with Dr. Stephen Lin. Hey friends, Mike Mutzel here with High Intensity Health. Thanks for showing up and tuning back in. I'm very excited today to be here with Dr. Steve Lin. Today we're going to talk about The Dental Diet. It's his new book that's going to be launching by the time you're watching this video. So we're kind of talking a little bit offline, Dr. Steve, about reversing or kind of changing the trajectory of children's dental health. I think that's a huge point of emphasis. I myself have a 5-year-old little girl at home, and she's got straight teeth and everything like that. But me growing up, I had like total crooked teeth and had to go down the braces route and everything like that, orthodontic route. But you were saying offline, you were at a conference in Portland, and the whole field is kind of shifting where we can affect kind of the expression of the mouth. I think that's
Mike, it's so important, and it's such an exciting area for me, being a dentist. For a long time in practice, we're told that crooked teeth are genetic, and so for your case, you were told that your mouth's not big enough to fit your teeth. You have to go and get braces, and you'll drag those teeth back into place. But we're now learning that craniofacial growth, it's actually a problem with what we're feeding our jaws and how we function. So the amazing thing is that the patients, the 5-year-olds that I see coming into the practice, they're suffering because their jaws aren't growing properly. Mm-hmm. And this is a huge issue. We're talking nearly a whole population don't fit their teeth. And how have we not seen this before as an issue that is environmentally influenced? But as a dental practitioner, I was never taught that in my training. And so this has been a big journey for me, and in learning how craniofacial is actually, we can intervene in it. Right. And so at your child's stage of development, so they're just about to start losing their baby teeth. And
she lost one so far, which is pretty
great.
Fun.
You're down the bottom, right?
Yeah.
So she's here wiggling it.
She smiles. It's amazing.
She's going to be gappy for the next year.
But it seems like, how are we changing the epigenetics? Because a lot of people that listen to the podcast and stuff are familiar with Weston A. Price and Pottinger and so forth. And then we know that the generation after introduction to Western food, sugar and processed carbohydrates, we do see a change in the phenotype of the mouth. Exactly. But you were saying with like modern technology and the function, we can actually pivot that trajectory, which I think is so profound. So we're kind of overriding that epigenetic expression.
Exactly. Yeah, exactly. And the whole message of epigenetics, which is so wonderful, is that we have control over what's going to happen. And so craniofacial growth is exactly the same. So the messages that we send to our jaw, our maxilla especially, so kind of the centerpiece is our upper jaw. So what messages your maxilla is getting is that's how your craniofacial is growing. So, and the main ways we send this functionally, before we get into the nutritional side, the feeding it is kind of the cogs and wheels. But the functional aspects as nasal breathing, which you know about, so that creates the forces that releases nitric oxide, but it actually expands the maxilla and the nasal sinuses. So people with crooked teeth, upper teeth, actually have high palates as well. And by definition, if you have a thin, narrow palate, V-shaped palate, nearly every child today has V-shaped palates, and this is the first thing that any parent should check on their child. Look at their palate, see if it's high. Palates, ancestrally were always flat, U-shaped, and very shallow. So they should be very wide. And the consequence of that is that the nasal sinuses are tiny. So that high palate is up sitting where your nasal sinuses should be. So we're actually depriving ourselves of the ability to breathe through our nose, which we're designed to do. And then so if we build this habit, then we start to get this whole process where the craniofacial system doesn't develop the way it should. And so it's impacted by breathing. It's also impacted by tongue function. So the tongue has to press against the palate. And so that actually, especially, and the real model is in breastfeeding. We see where the natural pushing of the nipple of the newborn mother's nipple to their palate. The palate is soft like wax, and that force expands out the maxilla, the palate. And so that's the first messages, the epigenetic messages, that those stem cells in the maxilla are getting to expand. That happens right throughout life. We are sending those messages. We can expand the palate even in adulthood. So we now have intervention methods right through the development stages, but even in adults where we can expand and get ourselves epigenetically where our craniofacial system should be. And then function all comes into it too. So the other factor is the tongue. The tongue is an amazing organ. It's connected to the entire craniofacial system, the base of the skull, the hyoid bone, the mandible. So it's like in a hammock. Wow. And so all its function, and it's connected to 6 or 7 cranial nerves. So the brain is like intimate. And if you think about the imprint on the brain of what the tongue takes up, it takes up a high proportion, and that's because it's so crucial. And the problem is kids aren't using their tongue properly. And so, and when their tongue is low, their mouth is open, they're breathing through the mouth, they're not breathing through the nose, and they're getting this long, narrow facial profile. And that's what causes, for the most part, crooked teeth. And that's what we're seeing nearly in every kid developing today. I don't see children that develop jaws that grow fit 32 teeth. Yeah, it just doesn't happen anymore. And that's the functional, we now know this stuff. This stuff is, there are systems, there are myofunctional orthodontic systems where we can get a kid growing right. And especially at your child's age, that's where we can really, really make some change. But we can go right up to 7, 8, 9, 10. After 12, that's where the developers set a bit. So they've kind of hit the adult dentition and the bones are less malleable, and so we'd need to, there's less we can do. But even in adulthood, I've seen 60 to 70-year-olds do expansion therapy, and their faces change. Wow. And we've done brain scans on their facial bones, and so the maxilla creates bone on the side that is deficient. But also, and this just shows you how pivotal the maxilla is that the mandible does as well. So all the other bones are taking messages from what the other bones are doing. So the maxilla is obviously connected via the facial muscles to the mandible. And then so as that remodels, as we expand it, the mandible remodels, the eyes, the orbits remodel, so people's eyes will level out.
Wow. In
6 months' time. I've seen the cases straight. It's amazing.
That's incredible.
The big one is the sphenoid bone even remodels. So sitting behind the brain case. If we correct people's craniofacial structure, the sphenoid bone will actually add bone, and that is changing people's autonomic nervous systems. People with deep sleep issues, and severe. These are people who haven't slept for 20 years, and it's all an issue with our craniofacial system not growing. Wow. So it's a fascinating. It's so exciting, but it's very, very kind of unfortunately we don't hear about it when you go to the dentist because it isn't in our dental curriculum, but it's out there. It's out there in its different forms, and we've really got to understand that we are, we have our own destiny in our hands, even into adulthood. Yeah.
Oh, it's incredible. I can see right now why the traditional model, traditional practitioners may not embrace this because it sounds pretty complex. You need to do a lot of lifestyle change. And the understanding that bones are remodeling, that they're active, that's just kind of emerged from research in the last few years.
Exactly.
That they're an organ, they're cross-talking with all the rest of the body.
Absolutely. That's the exact problem. We were taught in dental school that the midline of the maxilla, the palate, fuses when you get to, so that there's, it's set. That's it.
Done.
Yeah, exactly. No more of that. But there's stem cells there. So if you send messages, and you can send messages right now by pushing your tongue up there. If you do that 10 hours a day, the force, they've measured the force that you can push with your tongue is a very, very strong muscle. You will actually slightly correct like little snaggletooth teeth if you function properly and then breathe properly as well. So mouth taping, for instance, I've seen certain slight malocclusions, crooked teeth, just kind of correct themselves because you get the function right. But in kids, it's miraculous because they've got all the phases to go through, and then it's just miraculous from there. Yeah.
Wow. And it seems like maybe we've oversimplified things. I mean, you're talking about the tongue, like all the inputs. Like it seems to me like I've looked at the taste receptors, the bitter receptors, and so forth. That the first point of contact with food is the tongue and the mouth, right? So you'd want to have these messages sent into the brain that that's danger or that's poisonous or whatever.
Yeah.
But it seems like but if we send the right messages via our tongue, then that's where we also affect, like you said, PNS tone, parasympathetic nervous system tone, and everything. So
Absolutely.
we're never taught about our tongue. But no one, I've never. Yeah.
Well, that's the thing, I'm dentally trained. I knew about the different, I remember the tests we used to have on the tongue. We used to learn the nerves, the cranial nerves that go into it. We used to learn the types of taste receptors, which we didn't ever use because we weren't taught about food. But the tongue is such a complex organ, and we simply just didn't understand how complex and how crucial it is. And so its connection to the maxilla, it even changes from the newborn, the throat changes in that first 3 to 4 months. So it's with its connection to the larynx. So it moves and it matures. And that's so that the child can breastfeed in those early stages. But there is such a symphony of things going on that we're just learning. But it's all kind of pieced out. It's in literature in certain ways, in animal models. There's lots of clinical procedures out there now where we can get in there and prevent this stuff. But also the real one is that we need to get away from the idea of that we wait until the adult dentition for kids. So you say, oh, my kid's got crooked teeth, and then we extract. So we've been extracting teeth, extracting premolars, and we know now that takes away airway volume, and the results really are disastrous. It changes posture. So you see, I can nearly spot someone across the street that's had extraction orthodontics because you can see the facial profile. Their facial profile is sunk in, and because their maxilla, all the forces are taught back, right? We should be growing forward, and that's ancestrally. We can see that all our ancestors were far, far more forward. Right. But you can see that someone that's had extraction orthodontics, their maxilla is set back, but they've always got this forward head posture, and that's because they're opening their airway. Oxygen is the #1 nutrient. Something I really try and drive home in the dental does that we need to be thinking about our breathing, because without it, we're shot in a minute or two, right? So people that are skeletally damaged like that, what happens is they're set forward, and that's a response, a survival response, basically, to open their airway.
To just move forward that way. Okay,
yeah,
I see.
Exactly, and the cranium starts to sit. And then the force is distributed differently as well. So they have back pain, they have neck pain, they have lower back pain as well. They don't sleep well, they don't breathe well at night. There's a plethora of conditions of people that haven't developed properly, and even people that have had normal braces. So if you've just had braces, had your teeth dragged back in, then you've still got growth deficiency. So your teeth might look great cosmetically, but the airway
isn't solved.
Yeah, if you look at two hunter-gatherer skulls compared to modern skulls, you see that the crooked teeth result, if you look at from the back, the airway in the hunter-gatherer skull is this big, and then the airway on the modern skulls are much smaller. So a nice wide smile, which is what Weston A. Price was looking at, was it results in an airway that's nice and patent. Yeah, so it's a fascinating area, and the unfortunate thing is we're kind of moving into an epidemic of sleep disorders, and so people that can't breathe at night, 70 million Americans that have sleep disorder of some sort. Wow. And sleep apnea is heavily linked in the literature now to heart attacks, blood pressure issues, Alzheimer's, very, very connected to Alzheimer's dementia. Yeah. And it's a core issue with our neurological system not breathing. There's one dentist that wrote a book that talks about tigers stuck in a cage that's too small. Mm-hmm. And so we're basically stuck in a craniofacial system that's, and we're screaming to get out. Yeah. So I think that's the kind of the message that people, especially the ancestral community, is really taking on, is that looking at our ancestors, these are the things that made them so robust, and that's what our epigenetic and genetic lineage is supposed to be doing.
Right.
Yeah.
Right. Was that Dr. Park that wrote that book?
No. Dr. Park wrote a similar book. It's Dr. Liao.
Okay.
Yeah.
I'll have to put that in the show notes. We'll talk after, and
I'll
link
put that.
below.
Yeah. Actually, I've got it in the back. So
cool.
It's a good one. If anyone's interested in that, it gets right. It's very technical, but for healthcare practitioners, for airway issues and craniofacial, if they want to dive deep, I would heavily recommend that. Yeah.
Awesome. Well, I mean, I love where this conversation is going because we can really, get at the root cause of what's going on. So a lot of people are biohacking, which I think is okay. They're using blue light blocking glasses and night shades and blocking everything out. But if there's a functional, structural issue, that needs to be addressed. So that's why I love your book and the message that you're conveying here. And to kind of compare and contrast, the message that you're conveying, the allopathic, more traditional model is, okay, so the maxilla is small, can't fit all the teeth, so let's just remove the teeth.
Exactly.
And that's the total not the right way.
That is exactly the core problem. And that was what and I remember a case, there was a boy that came into my practice. He was referred by an orthodontist, and he was referred for braces, and he was 14, had a really nice set of teeth, but he had slight crowding, so his canine teeth were just sticking out. And so the orthodontist was like, well, you go to the dentist, we'll have those teeth extracted, and then we'll drag them into braces. And so his dentition was healthy, but here I was told to extract these teeth. And
the canines?
No, the premolar teeth.
Okay.
The premolar, yeah. So normally we extract one of the premolars, sometimes 4. I've seen people diagnosed to get 8 extracted to straighten. Yeah, and if you think about it, we're losing wisdom teeth as well.
Right.
The space loss, and that's all airway loss. It's really alarming. But so I remember looking at this kid and thinking, I don't want to pull these healthy teeth out. But I didn't have any. There was nothing in my training, and you're talking to a specialist, so you assume that what they're doing is based on sound knowledge, but we truly haven't understood that this whole system is dependent on everything working in order. And so I extracted the teeth, and I remember that boy walking away that day, and I was just thinking I did a real disservice to him, but I just didn't know why. And so that journey along and seeing all these kids that are sick and that with tooth decay and sleep disorders and their jaws not developing properly, it's just been such a journey to try and plug everything in. And it was all started by Weston A. Price. Yeah, this is all his work coming alive. It's absolutely fascinating because I think the biggest issue with his work was that we didn't understand it.
The mechanisms involved and everything.
Didn't understand it, yeah. Like he was talking about nutrition. He was saying craniofacial growth is and I've written an article about this on my website if you want to kind of dive into it. The craniofacial growth is affected by these foods. And look at these lovely faces of these people. He went all around the world, looked at ancestry, all observational data, but the message was profound. And this is all before the epidemic happened as well. Over 75% of kids now, and it's more, like you don't, wisdom teeth impactions are the same thing as crooked teeth. So we've basically rolled out what Price was saying not to do. And the health problems have played out exactly as he said. But we didn't understand. And so when I first found Price, one of my kind of eureka moments,
I've had many, it sounds like.
Yeah. Oh, there's so many.
Yeah.
But so when I never heard of nutrition and physical degeneration during my whole training, 7 years in 2 degrees, years into practice. I took some time off because I was disillusioned with my work. And I actually stumbled across the book in a travelers hostel in Turkey. And I was like, what's this? And then I flicked it open and I was like, I kind of looked at it and read, and it didn't make any sense to me. And I was like, it was interesting. It spoke to me in a deeper level. It seemed important, but I didn't understand it. So I was kind of like, my conventional hat was on. I was like, oh, this is all a load of hoo-ha,
Yeah.
Put it down, didn't come back to it for a while. But then it kept bothering me. I kept going and opening it up and looking at those faces. And eventually, I realized what he was saying. He said, well, hang on, nutrition causing malocclusion. And I was just seeing kid after kid after kid and the same problems. And they all ate the same thing. I was like, this is a diet related problem. And then I started to look elsewhere into all of the amazing functional medicine movement and how we're actually understanding, like you say, the root cause. And it's like, hang on, there's actual answers here for why bones don't grow, for what vitamin D does in the body. What the vitamin K2 mystery is one of the main reasons why we haven't understood all this. Because he had the piece from the start. He knew why bones weren't growing, but we didn't know what that was until 2007 when Chris Masterjohn kind of put the link together. And that's one of the piecing out stories in the book, is that we see how we had the answers there with vitamin K and the misunderstanding of vitamin K, and it's calling it vitamin K is it's K1 and K2.
Right.
And not having that piece of the puzzle because Price died before he identified activator X. And that wasn't really explained. When I was reading it, you kind of see activator X and you're like, what's that? And it doesn't register. And it took me a long time, even after reading Chris Masterjohn's stuff, I didn't even register what actually the implications were for Price's work to craniofacial growth. And now we can plug it all in, because K2 is linked to all the factors that are growing bones. We know how it affects the cartilage develop in the nose. So what happens is that we have a high amount of, it's nearly 20, some studies say 20% of deviated septum. And so the issue there is that during development, the nasal cartilage is calcifying because the body can't manage its MGP protein because the minerals aren't being taken out of the soft tissues, just like when we have heart attacks. So what happens, you get a deviated septum, you can't breathe through your nose, you begin to mouth breathe, and that's the start of a malocclusion, of crooked teeth. And that's a K2 issue. And nearly every person, you'd say 99% of the people in the conventional population don't get enough of K2. Right. Because it's not an easy nutrient to get. But we know now that, and if you think about what it does for growth signals in the body, so growth hormone, the insulin-like growth factor axis, we know it directly links to testosterone. So it releases testosterone in the testes in rats. And
Vitamin K does.
Vitamin K2.
Wow.
Yeah, it's amazing. We've got, it's just such in separated places, right? Yeah, but so it actually stimulates the release of testosterone. So it's a growth factor. And so and testosterone, we know, is connected. People with low testosterone, and we've got now a high amount of kids now, or people with low testosterone, and K2 is directly linked to releasing it from the testes. So it's all hormonal and gene growth regulation. And this is all Price's message, that A, D, and K2 all work together. Yeah. But we've got all the, it took me so long to kind of, and this is why I wrote the book, because I was like, there's such a story here, but we just haven't put the pieces together.
Right.
Yeah, and so, like the whole, the Weston A. Price Foundation and how they've reestablished that way of eating really kind of connected us back to that. But now we need the healthcare profession to get on board. We have all the knowledge we need to know what the consequences are of not doing this stuff. We know all the standard dietary recommendations are wrong. It's time to understand this and move forward in knowing that we can actually get to this root cause, because there is nearly no chronic disease that I couldn't reconnect back to the mouth. A process has gone wrong in the mouth first. And even if you go back to breathing, but if your jaws don't develop properly, you are putting yourself at risk of long-term disease across the entire spectrum.
Right.
When we talk about the oral systemic link, it's been very vague. We've known, for instance, gum disease. People that have heart attacks, 85% of them have gum disease. Who would have thunk it?
No traditional cardiologists really talk about that. That I know, it's not in their radar.
That was actually one of the things. Yeah, this is the thing. That was one of the moments as well that really kind of woke me up, because I had a patient come in and he was this old guy. He had a couple of standing teeth, really funny guy, but he was going in for a bypass surgery. And so he had severe periodontal disease all his life. And this was all tied into his heart disease and his type 2 diabetes. But so what the cardiologists do is they get a dental clearance, because they don't want a dental infection while he's going through surgery, because he's obviously going to have a long recovery time if he gets a dental infection. In the hospitals, they've got what are they going to do? Right. They don't know what to do. Yeah. And so what they do is they send the patient to a dentist to get a clearance. And so when I looked at that, I said, right, we have to take these teeth out because they're a risk of infection. And so we took his last teeth out. We planned to make his denture because he was going into surgery. His situation was quite urgent, but he never made it through. He passed away. And
after getting the teeth removed?
No, or teeth removed. So he went to get during surgery. So during recovery, he never recovered from the surgery. So he was in hospital for a few months and then passed away. And so we had his dentures there, and his wife came back, and that really struck me. As like, I'd not spoken to his cardiologist, and yet what I was looking at in the mouth, his whole life, gum disease develops over an entire lifetime, right from that first bleeding gums, and it's all connected to the gut. But he was coming in that final stage trying to get his teeth sorted out, And I just realized how wrong our system is and how disconnected we've put the mouth. You know, we've seen it something as we completely just fix. And when you have a toothache, you go to the dentist and get it fixed. And dentists have become that kind of reactionary, you know, a lot like the healthcare system in general. You know, we have, you know, medicine and surgery, and dentistry is probably up there on that. But our idea of that we actually understand the link to the body just hasn't been there. And the data on gum disease and heart disease has been around for decades.
Right.
Yeah. So.
Yeah. But I've read a lot of that data in the context of diabetes, periodontal disease, gum disease, in the context of blood sugar dysregulation. And they're very tentative to they say, oh, there's a correlation here, but we don't know which direction is causing which. Is it the blood sugar affecting the mouth or vice versa? So they're very reluctant and don't want to connect the dots like you've done in your book and in your practice and your blog. So I'm sure you have a lot to say on that. But what's burning at what I want to say is I feel like the dental profession, orthodontics and corrective care and going every 3 months for dental checkup, like it's high. There's a lot of money involved, right? Just like with anything. So if you follow the money, it's going to be hard to get this message out there because you're taking away. I mean, you know, if you're an orthodontist, you want a lot of patients coming in. That's like 10K. These are very expensive interventions. So it's going to be hard for this message to get out there. There's going to be a lot of resistance because there's finances here that.
It's interesting you say that, you know, but everyone knows the dentist is expensive, right? That's across it. No one thinks, oh, love going to the dentist because it's cheap. Like, it just doesn't. But I mean, it's the perfect example of how expensive reactionary healthcare is, and it's the precise, you know, kind of example of what's wrong with our healthcare system. The dentist is expensive, one, because it's not covered by the government because we don't think it's important. But two, we only go there for treatment anyway, and we know that treatment costs 7 times as much as if you spent $1 on prevention. So we're going there for treatment all the time. And so, but that's what we do at the dentist. And it's a great testament to what's wrong with our healthcare system in that we try and treat the end stage disease with expensive treatments. And to be honest, you know, dentistry isn't expensive. You know, dental treatment is a difficult thing. So you have to have high quality equipment. You have to have good materials. It's a very difficult environment to work in. You know, root canal treatments and dental fillings. You think about it. You're recreating teeth in a structure that's crunching at a couple of 100 pounds of force, and it's got digestive enzymes, secretions, and
bacteria.
Exactly, the oral microbiome. It's a nightmare. You try and reconstruct something in there, but it's so dental treatment itself, of course, is expensive. But the big problem is that we haven't been preventing. If we can get people understanding, and every dental checkup you do at home, if you understand every meal you eat and every, when you look at your child and how they function, how they breathe when they watch the television, and sleep, that's getting to the root cause of what's going to cause all these issues over the long term. No chronic dental disease happens overnight. Tooth decay happens over, mineral deficiency and imbalances in the oral microbiome. Gum disease happens over years and years and years. Malocclusion is the same thing. It's that 12-year period, and probably even prenatally, that we are setting up for this good growth and a well-fed functional system. No chronic disease in the mouth or in the body whatsoever happens overnight. Yeah. We're just missing the point completely. It's really, we've come to the point now where we need to fix that. Yeah, it's. I hope the mouth is kind of the beacon for this to kind of, well, hang on, we've been doing things wrong. Let's move forward with this. Yeah.
Well, the good news is, the mouth, there's the aesthetic component too. And everyone cares. I mean, people are naturally self-conscious about, having crooked teeth or, and then with your tongue, if your tongue doesn't function properly, that can affect speech. So we have like some good momentum going in that direction. And I definitely want to unpack some of the tips are in the book, but what's also burning, and I didn't want to interrupt your flow, going back to the conversation about the importance of vitamin K. Yeah. And we know that vitamin K, obviously we can get it from healthy foods, butter and animal products and so forth that Weston Price was espousing. But we also know that our microbiome is important, a source or a reserve or metabolic organ that synthesizes vitamin K, and then it brings back full circle to how you introduce this conversation about breastfeeding. And it seems like not being breastfed, you're not affecting the oral systemic, but the functionality and structure function relationship of the mouth, Absolutely. Then your gut bacteria is off. So it seems like there's a lot going back to that initial step of just breastfeeding?
Oh, absolutely. And the really important part of that is that we know that the mother's fat soluble vitamin levels will be passed to the child. So the breast milk will directly pass to the child. So if a vitamin deficient mother, which nearly every mother today is vitamin D deficient, that will pass vitamin D deficient breast milk to a child. That is so obvious to me in terms of how we have kids that aren't growing, our skeletal systems aren't growing. But the really amazing one too is how the gut microbiome seeds to the child's mouth as well. And really, we know so much about the gut microbiome now, but really the mouth, the oral microbiome, is our one that we can intervene in. And we talk about biohacking, and the oral microbiome, I can't believe people haven't got into this more, because dentists are up to our wrist in it all the time. But we know that the system that a mother's gut will deliver via the lymphatic system her bacteria to the breast, which will then deliver via the breast milk microbiome to the child. And then the child's oral microbiome then starts to seed the gut. And this is all before anything has happened. And so that's how a child's immune system occurs. And it's constant. And this is what you swallow thousands of bacteria every day. Yeah. And then so that, and in the first months, the oral and gut microbiome are actually very similar, but then they become distinct. So I kind of think like the oral microbiome is kind of like the bodyguard. They're kind of like weeding out and looking and then sending whatever's, whatever they think should be going to the gut microbiome. And then that's where the center of where we know all these health problems are. But it's all starting in the mouth. And like you say, from breastfeeding, and it's just such a beautiful, simple way to see how these disease processes occur. But the vitamin K2 one, it's so true in terms of the physiology is just really, even for healthcare practitioners, we just haven't, it hasn't been well explained at all. And so the distinction, so in medical school you get taught that vitamin K or K1, so sometimes they call it K1, but anyone that calls vitamin K, you probably, you're not taking in consideration the two types. But so K1 is in the blood coagulation, so it helps us to stop bleeding out. People are very rarely deficient in it, but it converts to K2 in the body. And so K2 we get from two sources, and so that's the one that activates the proteins that mineralize bones, so osteocalcin and MGP protein.
Which you're talking about with the nose that comes with the septum.
Yep.
Yeah.
So the matrix GLA protein is the one that, and it also carries out, so the studies that people show that have heart attacks when they have vitamin D and calcium, it's because they're not having K2. And actually one of the biggest signs that you're probably not getting enough K2 is just behind your front two teeth, if you've got dental calculus. So, and people have kind of a big buildup of dental calculus, it's because your body can't place calcium. And so it's a problem with K2. And now the coronary calcium score is becoming one of the primary ways that we diagnose, the cardiologists are diagnosing cardiovascular health. Right. So because our arteries are literally calcifying up because we don't know how to direct the minerals. And so this is all going back to what Price was saying, is that we need, for whole health, we need to eat these nutrients. And even K2, there's two types of K2, like you said, but you got the menaquinone 4, which is from the animal products, and that's really the one that Price was talking about. And because there's a slight deviation in the physiology, so the 4s are kind of eaten up quickly by the tissue, so they go off, and your body's really hungry for, and that's the ones that go to your testes, your brain for to really kind of the cell messaging that K2 does. But then the MK7s, which is the bacterially derived one, and which we formulate in the gut but also get from fermented foods, that one actually sits inside on the column and the lipoproteins, and more travels to the liver but also to the bones. So the bones and the osteocalcin activation to mineralize, that's more MK7. But both K1 and MK7 convert to MK4 in the body. So our body will be converting, so there's a whole process of K2 as well, which we really don't appreciate. And so getting different types of K2 is even, so we really shouldn't call, K2 needs two names. Yeah. MK4 and MK7 isn't good enough. It doesn't appreciate how different they are. Right. They're in the cycles, like K1, the blood clotting, and so, but that converts to both, to MK4 in the liver. So the naming needs to be, I think, fixed, because it just goes like this stuff has been lost for 70 years, and it's still being taught in medical schools like this. But we're starting to see that the calcium score for, because blood cholesterols and all these other measures for heart attack risk isn't useful. We know that now. That's straight up, junk science. But we know now, so well, hang on. If we measure how much our arteries are calcifying up and this matrix GLA protein, how carboxylated, how activated it is, we can actually see, that all goes back to your dental health and your jaw development. Yeah. And one of the main things that really woke me up too is that realizing that every tooth has an immune system. So you've got the osteoimmune system, spits out these little cells and they get directed to become odontoblasts, sits in the dental pulp, and they're activated by vitamin A and D. And so they actually protect your tooth against the oral microbiome. So that's why biological systems are immune to tooth decay. It's because we have an immune system. Because if you break your tooth in the wild, you're shot.
Yeah.
Like you're done. Mm-hmm. It doesn't happen in the wild in any significant. You just don't find it. But we have this biological system where A and D fuel these odontoblasts. It spits out the vitamin K2 activated proteins, and then it formulates an immune response. So it doesn't matter, as long as you're reasonably balanced with the bacteria you have in your mouth, you're going to be immune to tooth decay anyway. And that's something that we've actually knew. We were taught in dental school that dentin can repair itself. So we know that these odontoblasts, if there's an insult, the teeth can repair after tooth decay. To a certain extent, you can't repair enamel, but you can repair dentin. And it's all a function of A, D, and K2. It's insane that hasn't been, the most important thing that parents can do to prevent tooth decay in their kids is to make sure they're eating a diet and getting enough of these vitamins.
Wow. Yeah, there's so much there to unpack. But what's intriguing is that maybe a good dental health was selected for through evolution. Because like you said, I mean, in the wild, you chip a tooth or break a tooth, get an infection, you're probably going to die, yeah?
Yeah,
So it seems like those that had good teeth not only were maybe more physically attractive to a spouse, right, to another partner, so would then procreate, but it seems like there's multiple forces selecting for good hygiene. Yet when we look at where we are in 2017 or 2018, when people watch this, that so all these kids now are like having crooked teeth and so forth. So if that's not a red herring or a red flag, people need to, get your book and read this information, share this with a friend or family member because it's really key.
Yeah, it's what you talk about there as a biological messaging. We know faces are attractive, and so when you see a Hollywood face and kind of makes that your heart flutter, we're biologically attracted as humans to look at people's face, and we communicate via this very, very complex muscular system. And there's even talk of a plastic surgeon that drew a mask that was based on the Fibonacci and the mathematical beauty of the face. And so it's all based on nice white. So you can put the mask there, and all Price's work shows this mask perfectly. Wow. And so there's the perfect angles and the right relations come into play. But when we destroy that, it all starts to become, and so that's why, for instance, villains in movies will have like kind of longer or funny looking faces, because we
subconsciously just look at that as unattractive or perceive it
differently. Yeah, exactly. But now we can see that's exactly like why that occurs, because we're judging them based on their biological health. It shows us their airway, it shows us how they're feeding their skeletal system, it shows how they're feeding their immune system. It's all in the mouth. And that's why I think dental health needs to be the model for how we shape nutritional guidelines, because it's so simple for one, but it's so crucial. And if we get the mouth right, what I've been training dental practitioners in nutrition to build this into dental practices. If we get this right, if we make these simple adjusts, then everything else falls into place. And it just makes so much sense. If your skeletal system, if your hard tissues, if your body can't manage with your teeth and bones, you're in crisis. Like you say, in the wild, a toothache hurts so much because your body knows that if you have a problem with your tooth, you're nearly shot. There's no dentists out in the wild, and animals don't have orthodontists, or we don't have oral surgeons to pick out wisdom teeth. We've never thought of why wisdom teeth impactions occur. And it's just a problem with this jaw growth. And over 10 million teeth per year are extracted out. It's just pop them out when you get to 18. No thought on what the consequences or what the cause was. And it's all related to this, yeah. So food is the base of it. So once we fix our diet, then we can get the function, and then we can start building from there. And we have the healthcare model now. Functional dentistry is out there. And I think, with the functional medicine movement, I think we need that next step, because the functional medicine movement, dealing with difficult problems, autoimmunity, type 2 diabetes, all of these issues, neurological issues, they're hard to fix. We need to look at the mouth first and come from the outside and fix the whole system. And it's just so easy as well, like the oral microbiome is just such an opportunity. I can't believe, people, the biohacker environment, community haven't got into it,
Yeah. No, yeah, when you bring it up, it does make a lot of sense. And it is surprising that that's not really, there is so much talk about the gut and microbiome and fecal microbiota transplantation and fermented foods and all that, but you don't hear people, even though we can see our teeth, everyone smiles and chews, we often don't talk about that. We get so focused on SIBO and constipation, but you're like, the first contact point of food is the mouth, right? And then you got to chew and mastication. That affects, the cephalic phase of digestion. Like there's so many, but yet we kind of just talk about the cooler stuff because SIBO's hot right now. So I'm glad that you're taking the rein and just going for it, because this conversation needs to be had for sure.
Yeah, we're fixing it. We're understanding all these things are going wrong, but like I said, there's hard things that we need to kind of address. And interesting actually, there was a study that came out about 2 months ago about long-term mouthwash use and how it increased the risk of pre-diabetes. Wow. And so long-term mouthwash, and that makes...
Like Listerine or whatever.
Yeah, and supermarket mouthwash, yep. And so the mechanism there is so simple. You're decreasing the diversity of your oral microbiome, you're swallowing that. And we know that the type 2 diabetes has a characteristic gut microbiome. And so that's just delivering from the mouth to the gut, a loss of diversity that will end up in metabolic syndrome. And so, and then that's tying into the connection of gum disease. And the problem there is that, with mouthwashes, we don't understand the mechanism anyway. Yeah. We haven't even identified half the species that live in the mouth, yet alone we put antibacterial agents in there that kill off. We don't know what they do. They've got you look at the literature, it's very, very vague on how they talk about the mechanisms. And that's one of the problems, obviously, with fluoride as well, is that we say it's antibacterial. To what? There's so many species in there, and so anyone looking at their mouth, you should be thinking about diversity and as an ecology as well. So that's kind of the outside. We've kind of talked about the inside, the bone growing factors, but then we've got the outside and the gut and the digestive system. It's just an amazing system that our body is absolutely unreal, and we kind of look at a smile as being. An attractive thing. We don't think much more of it, but it's just such a testament to how amazing your body is.
Well, that's a good point on the diversity. It seems like the conversation about oral hygiene comes back to disinfect and clean, wash, floss so that you get rid of the bugs. So I think we're kind of trained from multiple angles that we don't want bugs there. But like you're saying, when we swallow, we're swallowing bacteria, and that's affecting the ecology downstream. So we don't want to disinfect entirely. Is that kind of the model?
Yeah, exactly. So, this goes back to the whole thing that the idea that tooth decay isn't a bacterial infection. Tooth decay is not a bacterial infection. Our body has the exact materials to defend against tooth decay. We've talked about the immune system on the inside. You feed that, but the outside is the oral microbiome. And so dental plaque, for instance, is called biofilm. It's got a biological function, and bacteria are building it to survive, and they're actually helping you. There's probiotic species in the mouth that are actually protecting you against tooth decay. So they'll actually they release acids that inhibit strep mutans, which is one of the primary bugs that pops up in tooth decay. But we've called tooth decay an infection, but tooth decay isn't an infection. It's actually a dysbiosis over a long period, and it's a nutrient deficiency, so the immune system doesn't work. So you have a dysbiosed oral microbiome going into starvation mode that's forced to go into the teeth to get the calcium out, because the oral microbiome is all in calcium.
That biofilm.
Yeah, exactly. So it transfers between the plaque to the saliva to the teeth. Bacteria are all in control. It's all controlled by pH. We explain that in chapter 5 in the book. Cool. But then this is where your gut's starting. Yeah. So dysbiosis and plaque in the mouth. These plaques are in the gut too. You think of all your villi. Yeah. That's all dental plaque. Times probably thousands to millions to whatever the number is. But we're going to get dental cleans. That's like taking a car with an engine problem to the car wash. Let's think about what's happening under the bonnet, right? It's we've unfortunately made a lot of mistakes, but the other thing too is you have to remember that the Human Microbiome Project only happened about 10 years ago. Right. So it wasn't that unreasonable, and it was only the 80s before that we really knew that any bacteria lived in the digestive system. But the dental industry has kind of been in this weird space where we've known about the tooth decay and bacterial links. So it's kind of been there, we've just haven't had the tools to kind of understand it. But it's all there now, and that's what I've really tried to bring together in the book, is that we have these amazing areas of science, from breathing to jaw growth to the microbiome to epigenetics, that are forming the face and the jaw and your teeth. And it's the easiest way to to model your whole body health, but also how you eat and how to understand how your nutritional input is crucially shaped by your oral health.
Yeah, that's so key. But you brought up strep mutans, right? So that's one. But if you were to ask 100 people off the street, like, hey, have you heard of a probiotic? They'll say Lactobacillus acidophilus or Bifidobacterium, and they say, well, what about in your oral microbiome? Did you even know you had one? They might be like, yeah, I heard. But so this conversation just really to reinforce, and underscore the importance of this, I think is just key, because I have so many people that comment on YouTube and whatever, and they do a SIBO protocol for small intestinal bacterial overgrowth. They're changing their diet. They can only eat like a small subset of foods, and they never talk about, and I don't even think about it, the oral microbiome. So I'm just really grateful for your book, for this conversation, because this is going to move the needle forward.
Yeah, it's definitely, we've avoided the dentist, but there is something to contribute. We're not just going to stick you with a needle.
Right. That's key. Gosh, this is awesome. I think we were offline when we were talking about the importance of the airway. We already have talked about that in many different ways, but how the airway dysfunction, from mouth dysfunction, the oral systemic connection, etc., how airway dysfunction induces a stress response. Can you just kind of rehash that, and then we have 3 final questions that we ask every guest. But yeah, let's talk the airway. Super important stuff, and then how does that affect stress?
Yeah, so with the autonomic nervous system is one of the most common series of symptoms I see in the practice is people that come in, and it's usually a thin female with a kind of a small jaw, dentist nightmare, you can't get in their mouth. But so what they do is they grind their teeth. But their other symptoms are they have digestive issues, they've usually anxious and sometimes on depression medications, they don't sleep well, they have cold hands and feet. And so this is all a syndrome of autonomic nervous dysfunction. And the issue is that when they're sleeping, their airway is actually, so we have pressure sensors in our airway. And so when you go to sleep, all the muscles relax. And so what happens is that when you have increased pressure, your brain is told that you're choking, so it's a survival response. And so that will kick your brain into sympathetic mode. And so the problem is, though, is that most people won't wake up and they'll actually pull their jaw forward. And so that's what teeth grinding is often a sign of.
It's
opening their way.
Yeah.
It's because it's a purely survival issue. It's because your body is designed to stop you from choking. But on the spectrum of, because we now have, sleep apnea is a huge epidemic now. But the problem is we're only diagnosing it at its most severe form when you have snoring, overweight males who are just a walking...
Thick neck and all that.
Exactly, obesity. But the core problem is jaw growth. And so that syndrome that I was just talking about is called upper airway resistance syndrome. And so there's an article on my site that kind of goes through that syndrome. But you actually will not be diagnosed by polysomnograph for sleep apnea because you don't have the apneas. So you don't stop breathing. But what's happening is your autonomic nervous system is in distress. This is how you're sleeping. They usually sleep on your stomach because you have to open your airway up. And you grind your teeth usually. But you'll always, afternoon tiredness, not sleep. Kids will have kind of bags under their eyes. And characteristically with kids as well is that they'll have this long face, mouth open, sleeping with their mouth open, always not behaving very well because they're going through crucial brain development stages where their brain is starving of oxygen. And so the connections between sleep apnea to the brain is in this deep sleep stage. What is happening is the blood-brain barrier is actually relaxing when we go to sleep, but only when you get to the deep stages. and then it lets all the cerebrospinal fluid in, and it replenishes and takes all the metabolites out, because through the day we keep a very tight barrier on that. But sleep is the period where you come in and flush. It's like a dishwasher. But in sleep apnea, if you're not getting to those deep stages of sleep, and even in upper airway resistance syndrome, if you're not breathing right, it's all connected by breathing, that deep autonomic rhythm and circadian rhythm. And so when we interrupt that, that's when we begin to get blood-brain barrier dysfunction. And then you can't regulate your sleep or circadian rhythms. You have autonomic dysfunction. You go down the road to blood pressure issues, heart attacks. That's why sleep apnea has links to heart attacks. And then the long-term road is Alzheimer's and dementia. So the process is all there, and all the studies are there showing how all of these things happen. We've just not connected it, and we don't understand that the first signs happen in the mouth, teeth grinding, any other issue that. Dry mouth in the morning even, or bad breath in the morning, shows that you're not quite breathing right, and there's a dysfunction in your microbiome. Not being able to breathe through your nose, is a surefire sign that you're not going to be breathing well at night. And so, like you said, I think that we're sleeping more now, but the quality of sleep. So if you sleep for, say, 5 to 6 hours, breathing through the nose, with great oral posture, with a then that's going to be much more regenerative to your brain. And we probably don't need to sleep. We probably need to sleep now. This is just my theory, by the way. So that we probably need to sleep more now because we have such a compromised craniofacial system and airway. It's all about retraining as well. The tongue is involved as well. So daytime tongue posture, so you strengthen your tongue, because all of those muscles there are holding the, if you open your jaw and stretch your tongue right up, all of those muscles become activated. And so when your tongue is up to the palate, you are activating and holding the airways open. When you go to sleep, when everything else relaxes, those deep airway muscles need to stay on. And so we're in the wrong posture now. We're in this slump posture. When we go to sleep, our airways just flop back. And so upright, if you look at kind of photographs of ancestral kind of, and their posture, they're all very straight up and these huge necks, right? And that's all because they have these amazing tongue muscles all slinging back to the hyoid, the base of the skull, and they're all on and activating. And we see now that all affects. We know that it connects to the development of the jaw, but we can fix all this. For instance, one study looked at how Australian didgeridoo playing actually helps and can cure sleep apnea, and even opera singing. So if you use your throat, so singing and humming is a great one. So that's one thing we do in the book. We do a hum before eating, but that's actually so you get yourself in diaphragmatic breathing. You breathe through your nose, you hum deeply from the diaphragm, and that kind of gets that system into play, and you learn how to use those muscles and keep the tongue to the roof of the palate. And so it's all a posture, and we've got the studies to show as well. Yeah,
that's amazing. Gosh, this is such great info, and I keep going back to like ancestral times and tribes, and singing and having different rituals, and we're so divorced from that now. Living independently, eating, not talking as much, on the computer or phone or whatever. So this comes back full circle. But I love that component, how the cerebral spinal fluid is kind of being massaged when you're in those deep stages of sleep, and so it just underscores that total sleep duration may not be so much as like the qualitative aspects and particularly the breathing while you're sleeping. So
absolutely,
just love that.
Something that the biohacking community might really like is to tape yourself. Video yourself when you're sleeping. You can watch. You can actually. There's a few apps out there now that actually monitor your how active you are when you sleep. So they'll actually test what levels of sleep you're going into via your movements. So you shouldn't move at all. So restless leg syndrome is actually one of the problems with upper airway resistance syndrome, because the autonomic nerve system is in rapid fire. Yeah. And even teeth grinding, TMJ issues. There's a plethora of kind of craniofacial pain problems that occur because we're in that very excited state. So if you tape yourself and watch how you sleep, if there's lots of tossing and turning, if you kind of find your blankets are all over the place in the morning, you're kicking your legs a lot, that's a sign that you're not really getting to these deep levels. But you can test this. You can get a sleep test as well, and but it's so crucial. You might be getting the 8 hours, with the blue lights, but the quality is really important. Getting that nitric oxide rich blood coming through the nose. If you mouth breathe, you don't get nitric oxide, and it's so crucial right down to mitochondrial health. the balance of nitric oxide in the body, and we don't even absorb half the amount of oxygen, or much less actually, if if nitric oxide doesn't mix with the air in the paranasal nasal sinuses going to the lung, and that's why nasal breathing is so important, because it's a nutrient in itself, nitric oxide, and so you only get it when you breathe deeply through the nose. Yeah.
So when you work out or exercise, do you breathe through your nose?
Yeah, that's something I've reached. So going through all this and learning, because I did the nutritional stuff, and then I went deeper into the sleep apnea, and I said, this is all connected. Vitamin D deficiency is deeply connected with the receptors on the brain. There's a great, have you seen Stasha Gomnick's work?
Yeah, I interviewed her, yeah.
Yeah.
That interview took off. People just loved her work. Yeah, she was amazing.
She talks about all and so she's actually cured people with sleep apnea. This is the same problem we're seeing. Yeah. So that's why her work's so great. And it's like, because she's looking at the vitamin D receptors, and like these are the core problems. And so oxygen, vitamin D, and then this is exactly the issue that Price was talking about. So once we marry that, it's amazing. I love her work so much.
Yeah, she's so passionate too.
Yeah.
Gosh, Dr. Steve, we've covered so much. I mean, people are just going to eat this information up. I'm really grateful for this conversation and the work you're doing.
Oh, thanks,
Fantastic.
Mike. But people like yourself really have kind of the people that are letting this stuff out. Because the information's out there. I've really tried to marry so that we can get the healthcare professionals into the people that understand this stuff, so that we can get a better model. I think that connecting the mouth to the body, it's just a conversation we have to have. So your work is really helping that.
Thank you. Thank you so much. So we have 3 final questions, a little bit more on the personal side. As you may know, we want to know, kind of a little bit more about you and what you do and what makes you tick and so forth. So we know that morning routines and rituals and things, kind of, win the morning, win the day sort of mantra resonates high with a lot of people that we've interviewed. So what do you do the first thing in the morning?
Yeah, first thing, I used to be a breakfast, kind of a cereal person, but that's something that I'm definitely a morning faster now, and that's something I've only come onto recently, and I thought I'd die going to the clinic and not eating, but a bulletproof coffee in the morning is definitely something that I feel that my body runs so much better without that. I try to do a breathing exercise. I really try to do a deep breathing and a slight meditation in terms of thinking about how you're delivering those nutrients via nitric oxide and through nasal breathing. So getting that deep diaphragmatic breathing, getting yourself ready for the day. Yeah. And I think about it really in a kind of a feeding sense. You're feeding yourself oxygen, and so breathing and I try not to eat in the morning, just purely out of obviously the idea of giving your body a rest and that fasting period.
Mm-hmm. So you kind of compress your feeding window a little bit. When's your first meal? Is it lunchtime?
Usually lunchtime, but I'm starting to go to dinner now. I'm stretching out. It's kind of very, I've always been a big eater. Yeah. But I'm finding now that, I thought, like writing the book and everything, you're there on the computer a lot. I thought, if you don't eat, you can't think as well. But I find that actually lunch slows me down a bit. Yeah. I think that, I find that if I have 2 or 3 coffees a day, without lunch and then eat a decent meal at night, that's kind of what my body enjoys the most. I like a big meal at night. I don't I probably shouldn't eat so close to sleeping, but that's kind of what I enjoy. Mm-hmm. So I like, but that's maybe something I'll look at in the future, kind of fixing a bit.
Yeah. But yeah, you're traveling, you're teaching, you're writing, you're researching and all that sort of stuff. So you find mental clarity and just like the convenience and the freedom when you become more fat adapted to not be so dependent upon, it's been 2 hours and I need to eat this food, or I'm starting to get the jitters or things like that.
Exactly. That's fantastic. Exactly. And that was, once I read Price's work and started to think about the dental diet, I was like, I got to do this myself. And that was the exact process I went through. I stripped all the processed carbohydrates out. I don't really eat fruit anymore. I enjoy a piece of fruit here or there, but I used to have a banana in the morning and an apple at lunch, and because I thought that was part of my 3 staple bits of fruit. Doesn't really come into my diet. And in the book, we actually go off fruit for 2 weeks, just to take ourselves away from sugar completely. And I'm not saying don't eat fruit in the long term, but because people are so flooded in sugar, and obviously in the dental practice we see that a lot. I think just 2 weeks off sugar. It's a 40-day program, so we do fruit in the first week, go sugar-free, and then readapt and into normal life again.
Yeah. Well, it's a good point, and then eat fruit when it's in season, right? If you live in Minnesota, you don't want to have dried mango on Christmas, maybe, maybe in the summer or something along those lines. Yeah. So it makes a lot of sense. So I love that perspective. Now, where do you sit on the whole ketogenic thing in terms of diet, lifestyle, etc.?
Oh, look, I mean, the ketogenic diet, obviously is carrying along on what all of these principles are, is that, we understand the body, it really is getting a better relationship with fats. The biggest thing that I actually, struggle with patients is getting them to understand all this, is to make them feel comfortable eating fats. Someone that hasn't, for instance, been in the whole kind of biohacking, if you say, you're going to eat more butter, you're going to eat more coconut oil, they think they're going to get fat. So I think that, the understanding how the body and, the neurological impacts are amazing. It is quite remarkable. So for me, I haven't gone as far. I've probably spent a couple of weeks or so, in that kind of range, but I don't go that, that low with carbohydrates. But for me, macros aren't really like what I'm trying, especially and as from a healthcare perspective, is to get those nutrients. So the nutrients, you're getting those nutrient dense kind of foods that we just don't get if you don't think about it.
Sure.
And yeah.
I see. So your perspective is just eat more real whole food. If you want to dabble in keto periodically, fine.
Yeah.
But someone like yourself, I mean, you may not ascribe as a ketogenic diet type person, but yet you're really compressing that feeding window, and that's a nice way to kind of circumvent the system without having to override, totally change your macros to get all this extra dietary fat. A lot of people that exercise too, they don't realize that they're keto, but they're mostly keto most of the time because exercise is a great signal. So. Yeah. Love that perspective. Because if you can only eat one meal a day, then you're going to be keto those other 18 hours, right?
That's exactly right. Yeah, so, completely.
That's awesome. Okay, you're stranded on a desert island. You can only bring one herb, nutrient, or botanical or whole food with you. Vitamin D and omega-3s are covered. What's coming with you?
It's going to be K2. I'm just thinking my favorite source of K2. My favorite source of K2. Let's say. You know what? I'm going to take a stick of butter with me. Yeah, that's going to be I'm going to have that in my pocket. I've loved getting reintroduced back to the love of the real taste of butter. Yeah. So I'm going to take that with me.
Love it. So in Australia, you live in Sydney, and you travel a lot, right?
Yeah.
But is there a good source of like New Zealand grass-fed butter? Or
yeah.
what? Okay.
Yeah. So you can get it's straight on the supermarket shelves. Yeah, and I think they say, because I did a talk in New Zealand just recently actually, and they don't grain feed the cows because there's so much grass there. They're like, we got to get rid of the grass. Got to feed the cows the grass.
Good problem to have.
Yeah, exactly.
It's like that in Ireland too. I mean, there's just these pastures are massive.
Exactly. Yeah.
That's great. Okay, so you're in an elevator with a parliament member from maybe the U.S. or the World Health Organization. They turn to you and say, Dr. Steve, we're going into a meeting now. We really want to influence the health of our constituents and the kind of communities locally. Give us a health tip that maybe can help us have a little bit more oomph with our discussions. What would you say to them?
I would say when we look at the chronic disease burden and the money that we're spending on healthcare, as we know that the ratio between prevention and treatment, we need to look at the levels of dental disease in society, which are up to 40% of people with tooth decay, gum disease up over 75% once you reach a certain age, orthodontia up over 75%, also crooked teeth, wisdom teeth impactions. These are all signs of other chronic diseases, and so we need to see the mouth and preventing dental diseases as the primary way that we can prevent all of these other conditions. So the amount of money we're spending on type 2 diabetes, that's throwing up against the wall. Why don't we look at balancing our microbiome and getting our dental disease? If kids don't get tooth decay in childhood and they don't develop gum disease throughout their life, then their risk of type 2 diabetes, we know via association. But so what we would do certainly is that if we can build nutritional guidelines around the mouth and dental health, we can simplify the entire thing. Forget about trying to cure the obesity epidemic via low fats and all these other things. It's time to look at the mouth and design our healthcare programs around dental health, because it's the baseline. Right. If our bodies are not managing our teeth and bones, then you forget about the rest anyway. That's we're going to be into stress as it is.
Yeah. And the gut will be imbalanced and much more.
Absolutely.
So a lot of just to kind of continue that conversation slightly further, the most effective treatment right now, not that I agree with this treatment, is bariatric surgery for type 2 diabetes. It's very effective. And then also the GLP-1 agonists and the different drugs that affect the gut hormones, which is just putting a Band-Aid on the symptoms.
It's just a Band-Aid, exactly. And the gastric surgery really does, I really cringe every time I hear that, because I can't believe people would go and do that, you know, as a solution, rather than, you know, just eat the right foods. And I think a big issue there is that they just can't find the right advice to fix the problem. And so that just really saddens me. So I really hope that, and you know, that understanding nutrition from the perspective of oral health and dental health will help them, and they'll understand that if they just fix their mouth and understanding what they eat for healthy teeth, it will fix the whole system. Yeah. So I hope we can, you know, find a solution for these problems.
Absolutely. And just to kind of finish the whole conversation, what I think is key about your book, your message, is it's participatory, right? So the one major problem with traditional medicine is you can just be innocent bystander, go in, get your drugs, get the surgery, and you don't need to change your diet or lifestyle. And your symptoms and the problems may reverse for a few years or a short period of time, but they're just going to come back with a vengeance. And we see that with bariatric surgery and weight gain and everything else. So your message is like, hey, you need to be involved, a participant, change your diet, your lifestyle, your breathing patterns, and much more, which is awesome. But a final kind of parting word of advice, or just a side note, we've interviewed close to 250 people on the show, and most people with the book are constantly pitching the book the whole time. And I love that this conversation, we just shared you shared a bunch of great knowledge, and we talked about the book a little bit, but I'm grateful for that you're just open to just take this conversation wherever and just really empower people and give people tips. So, but let's talk about the book. So it comes out January
9, yep. So it's available for pre-order before January, but it will be released in the US, UK, Australia, even Germany.
Awesome.
January 9. Canada
as well.
Yep,
okay,
Canada,
cool.
Yep.
We have a lot of Canadian docs that tune in as well. So is the main website for if people want to connect with you, your courses, and then you have a lot of articles and stuff. Where can they find that?
Yeah, so www.drstevenlin, so DRSTEVEN.com.
Okay.
And on social media at Dr. Stephen Lin.
Awesome. Thanks so much for coming on. This was a
thanks,
blast.
a pleasure,
really,
Mike,
really
yeah.
appreciate it. All right, guys, go out and get the book. This is a fantastic book. I read it on the plane over here a couple days ago. I'll put the link below this video where you can learn more about Dr. Lin, and also get the book through Amazon, wherever you live in the world. So thanks so much for tuning all the way in, all the way to the end. If you like this video, please give it a thumbs up and share it with a friend or family member that may need to hear this information. Talk to you later.